Open enrollment ends December 15th, and it can be a complex task determining which plan is right for you and your family. Janelle Davis with Nevada HealthLink joins us with some ways to simplify the process, and you guys really do have some helpful hints for people who can get a bit confused this time of year.
Yeah, so open enrollment, it's important to know the deadline is very quickly approaching, and that is Saturday, December 15th at midnight. But there is still help. We really encourage eligible Nevada residents who are looking for health insurance to get assistance from a licensed broker or in-person assistor, a navigator. And to do that, you can start the process by visiting NevadaHealthLink.com. We have an in-person assistance lookup tool, so you can actually put in your zip code and find an assister in your area, give them a call, make an appointment, and get the coverage that you need. It's really important.
Because right now, so many people are receiving calls from area codes all over the nation.
Yes, those robocalls. Yes. Robocalls, yes. Those are dangerous and scary and very annoying. Do not give your information to someone who is asking for your personal information. Nevada HealthLink is not associated with those robocalls. We will not call you. If you do provide your phone number to get contacted by a broker, they will call you and start the process with you. But the robocalls are not from Nevada HealthLink.
You mentioned procrastination. December 15th, midnight being the deadline.
Yes.
What are some other mistakes that people make when they're trying to determine which insurance plan is right for them?
Well, I would just say, I don't know if they're making mistakes, but to just get that in-person assistance help, because it is a complex process. And I think the number one question is really, is this affordable? Like, can I put this into my budget? How much is this going to cost me? We all have our lives to live and bills to pay, and what we're seeing is that there are zero-cost premiums available, there are low-cost plans available, and there's subsidies available. Subsidies are financial assistance from the federal government that help offset that monthly premium, which is what you pay for your health insurance.
And some other good news along those lines. Last year, premiums went up by some 40%.
Yes.
This year, it's not the same story.
It's down. On average, we're down about 0.4%.
At least it's down.
It's down. It's small. But, yeah, just see what you're eligible and see what's out there, because you really just don't know. And I think that's another mistake people make, is they think that it's going to cost them an astronomical price. And really, there's affordable options out there. And so, again, work with a broker to see what plan is right for you, because they're designed to protect you and your family from financial ruin if a medical disaster were to occur.
Yeah, it's not a one-size-fits-all thing.
No, it's not. These are all income-based plans, and it really just depends on the unique individual situation and what your medical needs are and what your budgetary needs are.
What are some other important considerations that families need to make when they're trying to choose which one is best for them?
Yeah, so if you have a pre-existing condition like cancer or diabetes, it's important to know that you won't be denied coverage. There are, from those robocalls, there are short-term limited duration plans out there, and those will not cover pre-existing conditions. They can underwrite. You can get thrown off of your insurance if you sign up for those. So just make sure you know what you're purchasing before you buy it. And those in-person assisters and those licensed professionals, they can educate you and walk you through the process, because once you have an insurance plan, it's important to know how to use it and what your benefits are.
Some great advice. Janelle Davis, thanks so much for being with us here today.
Yeah, thank you so much.
The final weeks of open enrollment are upon us, final days actually. There is still time to enroll, though. You do have until December 15th at midnight. You can go to NevadaHealthLink.com, or you can call that phone number 855-768-5465.